The roles and responsibilities of a community health worker is really about connecting people to resources, whether navigating the U.S. healthcare system, doing outreach with food insecurity, getting them connected to food resources, housing resources.
What people need to know about this work is that it's important. We have the ability to help people change their lives and be their own advocate, and what we do matters.
At Thrive Central Oregon, community health workers are key. Really, the work we do is all about community health work. Our job is to have all of the information for as many resources as possible across the Central Oregon area. And our community health workers are responsible to know what that information is, so that when individuals that are seeking housing or health insurance or basic needs assistance have a question, they can come see any of our community health workers and be connected directly to the service they're after.
What do students learn in this program? It is a 10-week program. Over those 10 weeks, we'll be working on things and strategies that they will actually apply in the workforce. So motivational interviewing is really important. This is where a student will learn about how to coach and motivate people to do behavioral change or set up a behavioral health plan. We will also have guest speakers, people from the community talking about what it's like to be a community health worker, types of things that they'll see in the community. Last but not least, they'll get an opportunity to work and partner up with people in their class, because being a community health worker is about connecting and being a part of the Central Oregon community.
I also really appreciate the opportunity to advocate for those that don't necessarily have the opportunity to advocate for themselves. And as a community health worker, I would be able to do that.
I think so my ability to speak Spanish is really important for the community, because a lot of people doesn't speak English in Central Oregon. And I think so this is a good opportunity to serve my community.
So what type of people are we looking for in a community health worker? This is someone who wants to make a difference in their community, but also have different types of skill sets. So someone who may be bilingual, who has knows Spanish, lives in a community that maybe is underserved and does not have resources. And also I need to mention, if someone's interested in maybe launching their career into the medical profession, nursing profession, psychology, all of those are welcome in community health worker, because in the end, the resources that you bring really make a difference in helping people get connected to services.
As a manager in a very busy role, I have very much appreciated that I was able to complete this course while still doing my full-time job and not have it become overwhelming or hard to, make both of those work together.
What's important about this class is that after you complete it, you'll be eligible to submit to become a traditional health worker. You'll be applying to the state, showing evidence of completing this class, and then will become a community health worker. This is very important because it opens up workforce opportunities, from working in a clinic, to a school setting, to health department, to a community-based organization. There is a high demand for community health workers, and we need you.